Hello everyone, welcome to our channel once again. And today we have with us Vaishnavi Patwardhan, who is a very dear friend, patient, an actor, and also skincare enthusiast. She has her own YouTube channel, and today we are going to talk about laser hair removal, everything about it. Welcome, Vaishnavi.
Thank you for having me. It's one of my favorite topics to talk about, so let's do it.
Yes. So the whole idea of doing this is we as dermatologists keep on suggesting and telling patients that okay, there are advantages to laser hair removal. There are
Mm-hmm.
practical advantages to it,
Yes.
and then we also have you who has actually undergone the whole treatment or the in the past,
Mm-hmm.
and you have seen both sides of the fence. So you have been where you haven't had laser hair removal and did everything else that goes with keeping your hair under control, and
Yes.
then now you are in a stage where you don't need to worry about that.
Yeah.
So we want to share that whole perspective with everyone as to how it helps get over the other side and then see the effects of it.
Yes, definitely. I would love to talk about this. I have a lot to share.
Perfect. So let's start with it without wasting any time. And what we are going to cover today is one, what laser hair removal is,
Mm-hmm.
and then we also want to see how it is actually done. Before laser hair removal, what your experiences were
Yes.
with the traditional methods of keeping hair under control. So, may it be waxing or shaving,
Yes.
even epilatory creams.
Mm-hmm.
And then we'll move on to the science of what laser hair removal actually is.
Okay.
And then go on to understand what your experience was while undergoing the treatment, how the treatment usually happens.
Mm-hmm.
So, the way we are going to go about this podcast is we are going to cover the basic of what laser hair removal is.
Mm-hmm.
We are going to see how your experience was prior to getting it. So
Mm-hmm.
when you didn't have laser hair removal, your experiences with the methods that are there. So there's
Yes.
waxing, there's shaving, there's
Yeah.
epilatory creams that are there, and then we will also discuss, like I'll be telling about what laser hair removal actually is, what's the science behind it,
Yes.
how it came into being and how it acts,
Mm-hmm.
and then go on to understand your experience of actually undergoing the procedure. So how do you
Yes.
prepare for the procedure, how do you actually make sure that you're during the procedure what all
Mm-hmm.
is done, aftercare about it, and then
Yes.
also comparing it with how before and after the procedure your experience has been.
Yeah. Life changes. Oh my God. I have
we,
a lot to talk about this, so let's get into
we
it.
want to listen about it. So great. I want to understand how your journey has been, right from what you were in your college days
Mm-hmm.
to now that you've been an actor and you are in the beauty industry. You
Yeah.
also are a big skincare enthusiast and talk a
Yes.
lot about skin care products and general skincare.
Mm-hmm.
So, in this whole journey, first talk about what your journey has been,
Mm-hmm.
and also what are the challenges that you have faced in terms of general skincare and in particular about your hair.
Yes. So I'm going to start from way before, from my school times, actually. So when I was a teenager,
I was
this,
actually going to say school, but like let's come a
yes,
bit
no,
closer.
because it's a very important part. I was, um, so it starts when I was 13 years old. Body hair was the biggest point of concern in my life because I had a lot of it, because I used to play a lot of sports, because I had to wear a lot of shorts, which was really embarrassing as a 13-year-old, when people around you want to look good and you want to look good, and your hormones and changes in your body do not let you look good for some damn reason. So I always felt like this was the biggest curse of my life. I know I'm making it sound a little over dramatic, but that's how important it was, because for a 13-year-old, it is a major
So,
concern.
just to understand this part about 13 years olds and 15 years old. So, when you're talking about 7th standard to
Yes.
about 10th standard is what
Hmm.
we're referring to the age group. Do people do girls, does it really bother them as much? And if it does, what are the things that they usually do? Do they go for waxing at such an early age?
That depends. Now people do, but back when I was in school, we had a lot of kids in class who had strict parents,
Mm-hmm.
and they wouldn't allow their kids to do any of those things
Right.
until they were at least like until 10th standard.
Okay.
So everybody had a different situation going on, and waxing was a huge taboo almost until like 8th standard at least, because an 8th
What
standard
were the
girl doesn't.
misconceptions about it? Like, what stopped people from going for a vaccine?
Okay, now it's very common for everybody to go in for hair removal. But because your skin is so sensitive and you're a kid, your parents also don't want to let you go for anything harsh on your body. Um, my mom was kind of okay with it, so she obviously understood that it was a big concern for me. So she let me eventually.
Mm-hmm.
I think I waxed when I was in, I think, 7th standard.
Okay.
So, and I had to. It was an absolute necessity.
How was the first experience?
It was awful because I had a lot of hair. It was so painful. I cried and I cried, and my skin was ridiculously red after the whole procedure. I don't know how people go through this every 2 or 3 weeks if you have a lot of hair. And then I realized, oh, that's just the uh, bane of being a woman sometimes is body hair. I don't, now it's not that big a deal for people,
Mhm.
but when you're in school, you do struggle a lot with body image issues, how you look, how people, what people think
And then
of you.
it also varies from school to school because all the uniforms are different, and then in some schools where there is full length uniforms,
Mm-hmm.
it's not as much of a problem,
Yeah,
say, as compared to schools where uniforms are where you
yeah.
have your legs exposed or your hands exposed. So,
Definitely. I think, and most schools around here have a pinafore or a dress for girls. They have knee length socks, which honestly are never knee lengths. Nobody wears knee length socks. I don't think I've ever in my entire school life worn knee length socks because they never reached the
yeah.
knee. Firstly, I'm tall, so they would always just end somewhere in the middle, and there was a huge leg exposed with hair, and that was not fun. Especially when I used to go play
Mm-hmm.
sports, there were a lot of people, a lot of girls who didn't have a lot of body hair. So I thought I was like a special
Right.
case. I needed to do something extra to go through this. And so, yeah, the beauty is pain situation started for me very early on in
Yeah.
life. And I didn't even know that laser hair removal was an
An
option
option.
back then. But the day I got to know, it was my dream and I manifested it. It sounds very cheesy, but I manifested this clinic and coming here in 2017 because it was a thing that I used to do every 3 weeks, which is very often. I used to go to a beauty parlor every 3 weeks or call someone over every 3 weeks to thread my eyebrows, for my upper lips, for my entire body. My overall beauty routine, back when I was a kid, so can't even call it a beauty routine, sounds wrong, used to take like half a day, so a couple
Wow.
of hours
Every
from,
3 to 4
yeah,
weeks.
because I used to cry in the middle and then stop them because it would burn and they would yank
Yeah.
it off. So I used to take my breaks. I
Mm-hmm.
usually called somebody home because that was more comfortable, and my mom was with me, and she would give me little like tea or lemon juice breaks to calm me down. And she would ask me, why is this so important? You can just let it go. I'm like, now I'm on it. Now I have started it. Now I can't stop it. Because now
You're
the
used
hair
to the
is,
smooth skin
yeah,
post
now I've
waxing.
seen what it looks like and it looks amazing. So I'm going to have to do it. Plus,
Mm-hmm.
once you do it, it's like patchy hair growth. Something, nothing is uniform as
Yes.
in it used to be. So now you
That's
have
also
to,
because of the hair cycles. Like,
yeah,
we know now that the hair grows in cycles, and there are phases when some of the hair are growing and some of them are not, and that is the reason
yeah,
why it's always patchy when it comes back post vaccine. And like you said, once you start it,
yeah.
you can't stop it.
Yeah, if it looks uneven, it's gotta go. So I started it, and it was for years the biggest problem of my life.
Mm-hmm.
I tried everything from waxing, threading, shaving, epilators,
Yeah.
wheat, and hair removal creams. I I can't say any of these things were good enough for me because something always would bother me.
Right.
Waxing was the closest to okay because I got used to the pain later and it wouldn't hurt as much anymore. But it was still a hassle.
Mm-hmm.
It's messy, and that's the only thing that bothered me later because I got used to the pain. But
Do you get ingrown hair or the bumpy
I
thing post vaccine?
I
Was that
used to.
troublesome?
Yes, because I had a lot of hair. I had a lot of ingrowth around like my knees,
Mm-hmm.
inside of my knees, and back of my hand. I didn't even know what it was back then. I would just think, oh, it didn't come out properly. But now I know. With laser hair removal, it reduced, and
Yeah,
now I know that it can go. I just thought it is there. You can't
yeah.
do anything about it. But yeah, waxing came close to the best option for me
Mm-hmm.
personally, for my body, because it would take off my tan also. So
Yes,
that was an added advantage for me. So I kept going on for that. And face, I used to thread a lot, which was the most painful thing ever.
it is.
Yeah,
I
that was.
can only imagine.
No, no, no.
It's
Eyebrows.
just plucking hair. It's like when you, like when men try to shave without applying a foam and then they do it on the dry skin.
Oh,
I can
damn.
only imagine what
Uh,
threading should be.
it's way worse, by the way. Because I will try plucking one hair from your eyebrow one day, you will know.
Yeah. So, in terms of the comparison, you said waxing was still better
Mhm.
because it gave that smooth appearance. What are the problems with shaving? What did you
Uh,
not like about it?
So shaving is now my go-to option. Um, it's the easiest, is the quickest. You can do it by yourself.
Hmm.
But back then, I had a lot of growth and I had thick hair, so it would leave a blunt tip
Right.
and
Yeah.
it would feel like stubble. So that was my least favorite. Plus, I know that people say that, oh, when you shave, the hair grows back more and thicker.
Hmm.
That's not what it was. I think you were the
Yeah.
one who told me that's not what it is when I started coming here. But yeah, it would leave like
That's
blunt
true.
tips, which was
So
very
what happens
bothersome.
is when you're actually shaving, you're cutting it down to the level of the skin. Inside
Yes.
the skin, the hair is still there, and it is going to grow immediately the next day. And when it
Yes.
starts growing, because you've used a blade, the way it's cut is at
Yeah.
an angle, and that's why when it starts growing, it is sharper,
Yeah.
and the thickness is same as what it was before. It doesn't grow thicker, it doesn't grow faster,
Yeah.
but because when you do waxing and you're used to getting that smooth small hair
Yeah.
start growing out and it's smoother, as
Correct.
compared to that, when you shave, you're just cutting it to the skin level, so
Correct.
this hair is still thicker, and because of the
Yes.
sharp thing, it's appears like it's thicker, but it's actually the same
It's the same hair.
thickness. Yeah,
Yeah.
and
I think.
there's no truth to the rapid growth part. It's the
Yeah.
same speed.
Exactly.
Yeah,
I think when you get a new hair, it's like softer because it is a new hair.
that's correct.
It's the same old hair that you're cutting. So, I get that. So that was my biggest problem with shaving. Another thing was when I would shave my underarms or whatever,
Mm-hmm.
it would feel like it's getting darker. So I
Okay.
don't know if that was because of the blade or
Mm-hmm.
the friction or what, but that
Friction
was.
is many times a cause,
Mhm.
but in general, also sweating and many times because of insulin resistance, because of increased weight.
Mhm.
That are some of the reasons why it is, the underarms or our pubic areas are darker.
Yeah.
Uh, but shaving as such, if it's done properly, like without with a proper foam or gel,
Yeah.
shouldn't lead to
Yeah,
darkness.
now I don't face that.
Yeah,
I feel
exactly.
like laser hair removal took out a lot of problems that I didn't really pay attention to, even like ingrown hairs
That's
and like dark skin,
the
quality
quality
of
of your
skin,
the
right?
same.
The
The
quality of your
quality of
skin just
skin
gets
improves
better.
because what happens is, even when the laser rays hit your skin and then they take out the hair, because the hair pigment absorbs all the laser rays, and
Yeah,
that's how the hair is destroyed.
yeah.
It also destroys other pigment that is there in the skin
Mm-hmm.
generally. So
Yeah.
in general, if someone who has undergone laser hair removal knows that the overall skin quality improves quite a lot because
Yes.
of all the heat that's there in the that's produced in the skin. There's a whole new process that goes on in the skin which improves the quality of it.
Yes, it targets a lot of problems I didn't think were problems, but now I don't struggle with them anymore.
Exactly. And then once that quality of skin improves, it's always better.
Yeah, much better.
That's true. That
Yes.
is true. Yeah. So now I want to understand. So we talked about waxing, we talked about shaving. Can you touch a bit more on your experience with the creams? So say wheat or other epilatory
Yes.
creams that are there.
Okay, so creams, my I haven't tried them a lot,
Mm-hmm.
honestly. I've used some maybe 2 or 3 times, but I didn't like the experience. Firstly, the smell really bothered me, and there's nothing you can do about it. You have to sit there. Also,
Mm-hmm.
psychologically, I always thought it was burning my skin, and maybe it was
Mm-hmm.
because it's chemicals you're putting on your skin. I know that none of these techniques are like that great for your skin.
Mm-hmm.
But I just felt like there's a chemical burning my skin,
Okay.
which felt a little off to me, so I never went
Wasn't a
on.
very pleasant experience as
Yeah,
such.
it
Okay.
just scared me a little bit. It felt like it's gonna cause
Mhm.
some like
Do
burn
you
or
have
something.
any friends who use it, and what are their?
Not really.
So
No.
it's not as common
No,
as
it's not as common. So
it's
now
talked about.
I did have a lot of friends back then
Mm-hmm.
who did use it. I also used them for like emergency purposes, so I would have one in my bag.
How fast do they act?
Uh, Not very actually. Not very. You have to like stay there, and that's the part that scares me. Also, now creams are much better.
Mm-hmm.
Like now they're
The better cream.
fragrant creams, and I don't mind giving it a shot once again if I
Mm-hmm.
have to.
Mm-hmm.
But back then, the creams were
But you
they
don't
had
have
a
the hair now.
I don't have it anymore. But that's why I would have been open to it
Mm-hmm.
because I did smell one of the creams that my friends was using.
Mm-hmm.
One of my friends was using.
It's more
She
pleasant now.
It's a little better. Was bearable for
Mm-hmm.
sure.
Mm-hmm.
So I'm like, okay, if it doesn't feel that crazy dangerous, I would not be averse to
Right.
it. But back then I didn't. There were, I think, one or two options in the market back then.
Mm-hmm.
So I didn't consider that to be even close to the best option.
How do you come to know about laser hair removal in general as a procedure? When was the first time you came to know about it,
Yeah.
and what were your thoughts about it? What were your apprehensions about it,
hmm
and how did that whole process of deciding to get laser hair removal come to?
So there was a clinic in the lane that my school was
Mm-hmm.
in around that area. So every time I would go home from school, I would see this beautiful lady with hairless body, just snuggling with herself on the on the
That's
poster.
actually a stock image.
Right?
It's a very
It is
famous stock image.
basically just like she's holding her
Yeah.
knees and legs, and she's hairless and beautiful and even skin tone and all of those things. I'm like, damn, you can look like that. I had no idea that you can make a picture look perfect, and that's not a natural
Yeah.
body. But I was like, oh,
Mm-hmm.
that's what I want to be. And this is a clinic that was I think specializing in all of these things.
Okay.
I had no idea about it, but I saw that image and I saw a couple of things written there.
Written there.
So that's the first time I heard about or read
Came to
about
know about it.
laser hair removal. And I discussed this with my girls from school,
Mm-hmm.
and everybody is mind blown. They're like, there's this technology that can take off all your hair. So also, we thought it was a myth
Mm-hmm.
because how can you stop hair from growing
Growing.
back? It seems a little unnatural and dreamy almost. So we didn't really believe it. Also, back then lasers weren't very developed,
Mm-hmm.
so it would take a long time for it to actually
Do the whole procedure.
show any results. Also, it seemed very dangerous because lasers back then are like, oh, lasers could destroy you and destroy humanity.
Yeah.
So it seemed a little shady back then. So
And
it was a dream.
so like you said, there was because there was not much information available about it in terms of understanding how it works.
hmm
There's that thing where okay, it may harm you, but
Yeah.
does it really work? Is it
Yes.
something actually that would give an effect? So that information mismatch
Yeah.
is what also didn't make a lot of people go for it.
Yes, definitely. Also, back then, now people are much more open to beauty
Mm-hmm.
treatments and anything in the world generally. But back then, parents used to be like, कुछ तो नया है गलत है गड़बड़ है इसकी ज़रूरत ही नहीं है
Yeah,
हम ऐसे जीते आ रहे इतने साल हम तो ठीक है तुम भी you can also survive this there's
we've
not
lived
that
with our
big
hair.
right we've never done anything with our hair
Yeah.
and my mom she has no hair okay so I mean you don't even understand how bad it is
It's like blessed by birth.
she's blessed and she's like I survived my whole life I'm like yeah because you don't have a single hair so you have no idea what my problems are right now so please let me do whatever needs to be
Hmm.
done so she let me go for waxing that's the first time she's like fine I understand you can go that's how it is
How did you decide, like, when did the information reach you that okay, this is something I should try, and how did you go for it?
I think this is when I got into beauty pageants
Mm-hmm.
um as somebody who didn't do that earlier and would just go to college like a normal person
Right.
It was normal. It was great. I had a cycle where I would know that my social events and my outfits have to be set according to my hair cycle. So I would wear jeans when I had half of the hair growing out, and other times I would wax and then wear the best clothes I have and like
Right.
shorts and everything. Back then, so it would all align. I would know how this is gonna go. But in beauty pageants, you can't do that.
Yeah.
Every time you have to be on stage or do anything, you don't have the option of choosing what outfits you're going to wear. So that's when I'm like, I can't wait for my hair cycle to be completed.
Correct.
Everybody suggested I should shave because
Mhm.
every other person was doing that. And it was just so off for me. I could not, because I've been on waxing for so
Right.
many years and it seems so smooth and nice. And there was this time when I struggled. I had this whole limbo. I was in this limbo where I would wax,
Mhm.
then half of it would grow out, and then I would shave. Now the smoothness is also gone. Now half my hair is gonna come out, and I don't know what to do with it.
Stuck both ways.
So I had to find another alternative. That's when I really considered laser hair removal,
Mm-hmm.
because in the pageant circuit I got to know
Yeah.
more about this. There were a lot of beauty treatments happening. There's a lot of facials and pigmentation and stuff. Although when you're 18 and 20, these things you don't need, but laser hair removal at a clinic is something you totally go for. And then I found out about this
Yeah.
clinic. This clinic was the first time I actually spoke to somebody about laser
Right.
hair removal. And I
And
think
that was what, like 6, 7 years back now. Yeah. 7,
2016 or 17.
6, 7 years back. It's a long time.
Long time back, yes.
Great. So when you actually came in for a laser hair removal process,
Hmm.
and I'm going to speak a bit about what actually happens in a laser hair removal process.
Yes.
Uh, as a general rule, our hair are growing throughout our body, and we have something known as melanin, which gives color to us.
Hmm.
So it gives color to our skin, and it gives color to our hair also.
Hmm.
And in hair, it's more concentrated, and that's why our hair are darker than compared to the rest of the skin.
Hmm.
And when we use a laser to do laser hair removal, what it does is all the rays of the laser get attracted or get absorbed by the melanin in our hair,
Hmm.
and that's what heats the hair, and that heat is what causes destruction of the cells of hair, the hair follicles,
Mhm.
and also the stem cells. So our hair grows in a cycle. It has a growth phase known as anagen, and then it has a resting phase known
Mhm.
as telogen, and there's one phase in between, which is the transition phase.
Mhm.
And when the hair fall off or shed, because it happens in cycles,
Hmm.
there are stem cells in our body which lead to new hair growing out. So even if
Yes.
our hair shed, we see new hair coming because of these stem cells. The whole purpose of the laser hair removal procedure is to destroy that stem cells which are there, which lead to new growth.
Hmm.
So you destroy the hair follicle which is growing right now, and you also destroy the stem cells,
Yeah.
and that is how there is reduction in the hair growth. So even if we call it laser hair removal, it's technically more of laser hair reduction, because
Yes.
some of the hair still are there. They grow in smaller amounts,
Yeah.
in a very slower rate, because you have destroyed the stem cells.
Yes.
And that is how the whole process of hair removal works. You have to repeat it frequently initially. So on an average, the number of sessions that are required are between 6 to 12, maybe 15 in some cases, 6 to 16.
Yes.
So if someone has a more hormonal propensity,
Mm.
they have the hormonal levels are so that they're stimulating the hair quite a lot
Mhm.
as compared to normal. That may show that you will require more number of sessions. Someone who has PCOD usually requires more number of sessions,
Yes.
and also if the laser parameters are not correct.
Yes.
So if even after the first few sessions you're noticing that you're not getting a reduction as much as you would want it,
Hmm.
or the doctor thinks, there is a chance that the
Change.
parameters are not optimal, or the technology is limited. So there are various technologies of laser hair removal,
Mhm.
mainly three types of it. One is the alexandrite laser, then there's a diode laser, and then there's an andiag laser. So different wavelengths work at different levels and have advantages and disadvantages.
Okay. So which one did we use for me
So
initially?
initially, what we were using is a 810 nanometer diode.
Diode.
So
Yeah.
that's the luminous diode that we have.
Okay.
It's one of the best machines in the world.
Yeah.
The limitation of that is because of the wavelength that it works in. You can't increase the parameters beyond a certain level after some time.
Okay.
So, and that is when later we shifted to a Nd:YAG laser,
With the
which,
one which we
yeah,
have
which
now.
we did later, and that helps us reach higher energies
Okay.
without the side effects, because after time you have to increase the parameters to target the smaller hairs. But then, if you start increasing the parameters, the chances of burns also start increasing. So the
Correct.
side effects, the risk of side effect increases with the wavelengths which come, like the diode or alexandrite. So with the Nd:YAG, it then becomes possible to increase the energies without the risk of side effects, and that's
Okay.
what we shifted to later. So it's also important that you have that versatility in terms of what wavelength you want to use
Mm-hmm.
and what parameters you want to use. So if done properly, in between 6 to 12 sessions on an average is when you would get a satisfactory reduction.
Yes.
In some patients, maybe up to 18.
Mm-hmm.
So overall, and then the sessions that you usually do is
Hmm.
when you start seeing hair growth. So
Yes.
for each area of the body, you have to plan the sessions accordingly. For the face, maybe initially every 1.5 month.
Mm-hmm.
For our hands, legs, the bikini area or axilla, maybe every 1.5, 2 months.
Mm-hmm.
Later, once you're done with 3, 4 sessions, then
Yes.
you increase the uh, gap in between sessions to
Yes.
maybe 3 or 4 months. So it depends on how your hair are growing, and
Mm-hmm.
it's very individualized and personalized as to when you want to do the next
Mm-hmm.
session.
Also, would you say that um, since you're saying it's some hair keeps growing back, do you think a yearly or a once in 2 years maintenance
Yes,
laser hair
yes,
removal
yes.
is necessary?
Maintenance is necessary.
Yeah.
So the way it's done right now is once you complete your session and you're comfortable, have a good reduction in growth. Usually a yearly maintenance is what we advise,
Yeah.
so that you come in and you see areas where there's still some amount of
Yeah.
growth that's happening. There are resistant areas in our body. So we do advise that maybe once a year,
Yeah.
once in 2 years, you come get a maintenance done,
Mm-hmm.
so that then you're pretty comfortable and don't need to do waxing even in smaller
Yeah,
areas.
that's what's happening with me right now.
Yeah,
There are patches where I think I
exactly.
can use a maintenance or a follow up
Correct.
treatment. Also, this is another problem I initially had with
Mm-hmm.
laser hair removal. A lot of people, a lot of clinics rather, the first thing that they say to their patients is, "Oh, 6 sessions mein we will get rid of your problem entirely." And it's a little misleading because
It
everybody
is.
comes to you with like such hope,
Yeah,
and they have no idea how this works. And if you tell somebody it's going to go off in 6 to 8 months, you will have disappointed patients.
exactly.
Always. They will come back to you telling you, or will tell other people, "Ye nahi kaam
नहीं काम
karta."
करता है. So because of the incorrect promises,
Yeah.
the procedure gets into a disrepute
Yes.
for no fault of the procedure or the
True.
lasers. Just because you've been promised something which is not correct,
Yeah.
then it becomes a problem. So as a broad rule, 6 to 16 sessions, depending person to person. There are
Yes.
people who do
Get done
see
with.
results in 6 sessions also,
Mhm.
but there will be people who will need more sessions. So it
Yes.
6 is the minimum that we usually tell.
Yes.
And like you said, because there is a huge variation in the cost of lasers. So
Yes.
a laser hair removal device can be bought for as less as say 8 lakh 10 lakh rupees,
Oh.
and it can be as expensive as say 70 lakh rupees also.
Yeah.
So depending on which laser is being used, the cost for the clinics and doctors also varies. So there
Mm-hmm.
are clinics who do full body laser hair removal per session for as less as say 6,000 8,000
Yeah.
rupees,
Yeah.
and then there are places where you can get it done for maybe 20 30,000 rupees per
Mm-hmm.
session also.
Yeah.
So there are various factors which come into play in these, and the patient needs to be aware of that.
Yeah.
uh,
Pricing is one thing that people really, because it's so different in every clinic.
it's not transparent.
Yeah, you don't know how to choose
Yeah.
also. You have no idea about the technology. You have no idea how many sessions you're going to need. And
Yes.
you have no idea why there's such a vast difference in the pricing of two clinics. How do you know if this
How
one's
do you
better
judge?
than that
It's
one?
very difficult. So
No.
you have to go, like, you have to get a basic trust
Mm-hmm.
established in the doctor and in the clinic. You need to know that, okay, the bare minimum of the quality of technology that
Yeah.
needs to be used. So there
Yeah.
are two major factors here. You need to have a bare minimum quality of laser.
Yeah.
That's one, and you need to have a person or doctor who knows how to use that laser, what
True.
parameters, how to use them.
Of course.
So
And it is a trial and error
yeah,
process.
yeah, it
For
is.
every person is going to be a little different.
It takes a while to get used to the machine, the parameters for the doctor.
Yeah.
And once a new patient comes in, to see how that patient is responding to the parameters that the doctor or the company has come up with their experience.
Yeah.
In 1 or 2 sessions, you're able to match those two things,
Yes.
and then that leads to faster results.
Yes. I also know that the difference that you're talking about between lasers,
Mm-hmm.
the diode was great
Yeah.
because I completed most of my treatment with that
Yes.
and I was very happy with it. And now I've seen the new machine, which is excellent. And
That is
one
true.
area of my body had was yet to be done, so I started with that. And I said in one session it gives such a huge result.
Significant difference. Yes.
It's crazy. So
So
it
in
does.
India, as such, by far because of the kind of skin that we have, diode is the standard thing that's done.
Yes.
It's like the most common laser,
And
and
it
it
works.
works. It
Yeah,
works in 80-90% of the patient. It works in 80-90% of the areas.
yeah.
There will be some resistant areas where you need to increase the parameters, and the diode may not be enough, and that's why you need that versatility where you want to use another technology or another
Hmm.
laser wavelength to give those results. So that is where it helps to have a different technology of laser hair
Yes.
removal.
Do you think with a laser a machine,
Mm-hmm.
you can target areas that don't have a lot of hair growth
Mm-hmm.
and the hair growth kind of starts happening from there, which
Yeah,
is
yeah,
why
yeah,
you
yes,
don't
yes.
overdo it?
It's not about not overdoing it. It is a thing which is known as paradoxical hair growth.
Yeah.
Yeah, so it is a known thing. It's a known side effect of laser hair removal, and
Hmm.
how that happens basically is, in general, the body is a very intriguing thing that God has made. Uh, while lasers, if given in the right energy and the right fluence, can destroy the hair follicles. If it falls short, then it leads to hair growth. So
That's
that's
insane.
yeah, and that's how there are lasers for hair growth also. So patients who come to us for hair
Oh,
loss, who have hair fall,
yeah,
like
issue.
androgenetic hair
Yes.
fall issues, there are lasers which help in treatment of that also. So there's low
That's
level laser
crazy.
light, and there's other different types of lasers that are there.
Yeah.
So in that, the energies that we use for treating hair loss
Hmm.
are a fraction of what we use to treat what we use to do hair removal.
Correct.
So when you're doing laser hair removal for a particular area, and if you're doing it for this area, say, and
Yeah.
because there's heat that's produced, and if in the areas besides it, that heat doesn't go in the same energies as in which you're targeting it,
Oh no.
so it kind of stimulates the other area to produce more hair.
That's
So that
crazy.
heat or that energy is what stimulates the hair in the areas
Hmm.
besides it to create more hair. Or even in the areas that you do the razor, if the
Mm.
parameters used or the parameters that actually come out of the laser are not the same as what you
Yes.
want to put in,
It's lesser than
if the
the
quality, and that
recommended.
happens usually when the quality of machine isn't great,
Yeah,
then you get paradoxical hair growth.
correct.
So
Because
that is very correct what you have observed or what you
yeah,
have heard. Then
no,
that's
from you
known as
only.
that is known as paradoxical hair growth,
Yeah,
and that's something that you need to be aware of.
yeah.
There are many beauty salons and parlors who use
Yes.
a kind of device which is known as an IPL,
Yeah.
so intense pulse light. It's not actually a laser; it's a machine which delivers multiple wavelengths in one
Mm-hmm.
ray. So it's
Mm-hmm.
intense pulse light that is specifically known to cause more amount of paradoxical hair growth as compared to
Ah,
lasers.
so
So
yeah,
because
that's where
that
I was gonna
comes,
go.
yeah, that comes in
Mm-hmm.
as a cheaper machine. It's a
Mm-hmm.
cheaper technology, but it has higher incidences of the side effects.
Yeah, that's where I was getting at because this is why it's important for people to also know
Yeah,
and go to a professional who really knows this stuff and has enough experience because there are these little nuances that nobody even knows about.
exactly.
Because this is a thing that you told me about my chin, and I'm like, can we just like do it off? And he said, no, you can't just target a laser at an area where you don't have hair.
Yeah.
Why do you want to do this? That's when I'd asked you this
Yes,
question, and I
yes, yes.
remember
And
this.
what happens is because beauty treatments are coming in at every place. So there
Yeah.
are parlors who do lasers, there are salons which do lasers.
Yes. That's
Uh,
scary. Little.
you can't always be sure that the person who's operating it knows the correct way to operate it.
Yes.
That's one. And uses the correct technology to do it.
Yes.
And that is where again the fact about the cost variation comes in. Even the NDAG laser that we do, so
Yeah.
for the Q switch NDAG laser that we do
Yes.
for pigmentation and
Uh-huh.
stuff, that also starts right from a range of 2 lakh rupees for a very basic Chinese model,
Yes.
and it goes right up to 1.5 cr for a good quality
Oh my God.
picosecond laser
Yes.
which treats pigmentation.
That's also a new one that
That's the
you
new one
got.
that we
Pico
have.
laser,
So
yes.
this variation, it's what causes a lot of people to get not exactly fooled but disappointed by the treatments
Yeah.
that they do and lose trust in the treatments.
Definitely, because everybody has an alternative for this. You also get home
Yeah.
machines, which the machines you can buy, keep at home, and keep
Yes.
doing it. What if you don't know anything about this? It's so scary
So
to mess with
if you're
yourself then.
referring to the hair removal machines that you can
Yeah.
use at home, that's the same technology that I'm referring to. That's also an IPL thing.
Yes.
So IPL machines, intense
Different
pulsed,
wavelengths.
they are big machines also, and then they also come in the
The
Philips one is
small
there.
one, yeah. How
Philips.
how effective are those?
So they are effective. I
Okay.
wouldn't trash them
No, of course not.
completely
I just want
because
to know.
they are effective. They help in reducing the growth.
Hmm.
Maybe not as effective, say, as a professional hair removal
Yeah.
laser that we use in the clinics. But for someone who can't get access to it, or someone
Yes.
who's okay with doing it at home for a longer interval, so they take more number of sessions.
Yes.
The reduction is not as great as with a laser, but there is a reduction. So if
Great.
that is going to satisfy you, you might as well use it.
Oh, great.
There's one thing that you need to be worried about or be careful about again is the paradoxical
Hair
hair
growth.
growth. So that is something that you need because the energy used are less, the chances of side effect increase. That's
Definitely.
the only thing that you need to be
I think the
careful
bottom
about.
line is just doing your research
Yeah,
and ideally doing this with a person you trust and has
exactly.
experience.
And if
If you can't do enough research, at least, if you can't access the best treatments, just do your research properly for sure
and
because there's a lot of things that you don't know.
my thing is with these home based laser like removal devices, the total cost goes to as much as doing it at a doctor's place at someone who's
Yeah?
trained. Yeah, those machines I think come in the range of 60 to 80,000 rupees.
Oh, really?
That's
Okay.
as much as it
Yeah,
would
as
cost
much
you
as it.
for facial areas to get hair removal done.
Yeah.
So unless you're looking at body, and then if you're going to do your body with that small device, it's going to
It's
take a
gonna be
long time.
hectic.
Yeah,
No, for sure.
it
It's just
takes a long
easier
time. It's
to
easier to
get
do
it
it.
done with someone else.
Great. So now let's talk about the actual procedure
Yes.
in general of what to expect when you actually decide to go in for a procedure.
Hmm.
Yeah. So in general, how we advise patients is they come in for a consultation and they want to understand more. So the
Hmm.
doctor usually examines what kind of growth they have. If required, if there are other signs of PCOD, so hormonal issues that are
Yes.
there, we usually get it investigated or also refer to you to an endocrinologist or a gynecologist depending on what the main concerns seem to
Nice.
be.
So it's a holistic approach to everything.
100% because you have to be aware that like I said earlier also, if you have PCOD or hormonal issues, it's going to take more number of sessions.
Yes.
So that's something that you need to be aware of.
Hmm.
And when we talk about PCOD, it's usually excess hair growth,
Hmm.
hair loss. So
Hmm.
on the scalp you're experiencing hair loss, irregular menstrual periods,
Yeah.
cycles. That is all the things that we usually look at clinically. And if we see signs of that, then we advise you to get a
First.
ultrasound
Hmm.
and workup, and also refer you to an endocrinologist so that we know what the seriousness of the condition is.
Correct. Also, hormonal changes wise,
Mhm.
PCOD patients do struggle a lot more and is going to be more difficult for them. Also, when the hormones switch over, it's going to come back a little bit, the hair.
Yes, yes.
It's going to be the same thing with somebody who doesn't struggle with that also. When the
Not really.
hormones
So,
change,
no. So when I think what you're referring to when hormones changes menstrual cycles,
mm-hmm.
not really. So the hair cycle is not really affected by the menstrual cycle,
Hmm.
but in general, when PCOD is there, your hormonal levels fluctuate in terms of how the ovarian cycles run,
Correct.
and that is to an extent related to the menstrual cycle. But
Uh-huh.
in normal people, it's not.
Okay.
So in normal people, the hair removal and menstrual cycles are not usually related.
Okay.
Only when there is a PCOD component, that time
Mhm.
it's something that we need to be aware about.
So eventually in life, if
Hmm.
somebody is done with the laser treatment,
Mm.
and then they go through hormonal changes, major changes
Right.
in them, do you think it will
It
affect
may
it a
trigger.
little
So
bit?
with laser hair removal, we are what we are trying to do is eliminate maximum of the hair
Mhm.
follicles and stem cells that are there, but there are still some which do stay in our body. And if there is that hormonal fluctuation that happens, it is possible that it triggers the stem cells and leads
Yes,
to some amount of hair growth. So that is possible,
correct,
but it won't be to the same extent as it was before when we started the procedure. So
correct.
it won't be the same severity of hair growth, but
Okay,
there will be some. It's possible to have those
okay.
fluctuations in it.
Also, even so, when somebody comes in for a consultation, if somebody has a lot of questions and they're not sure whether they want to go in for it or not,
Okay.
would you still advise just having a consultation done and then deciding if,
Of
because a
course,
lot of
of
people
course.
are a little
So they
stressed
just
out
want to
about,
understand the procedure
yeah,
more. So it is the doctor's responsibility to get all your doubts sorted out.
yeah,
So whatever doubts you may have about the procedure, they need to be sorted out before you go in for the procedure.
correct,
That's bare minimum. So even if you have doubts and are not sure whether you want to go in for it or not, you can always get the consultation done,
correct.
understand what the procedure is, what are the frequencies that you're going to require for the procedure,
Hmm.
what extent you will require. So usually, like I said, we advise about 6 to 16 sessions with a gap of initially, if it's the phase that we are talking of, the initial 2 or 3 sessions maybe after every month. After that, maybe after every 1.5 2 months, depending on how your hair
Okay.
growth has reduced. If it's the body, so hands and legs, its initial sessions are with a gap of 2 months each.
Hmm.
Once the growth has reduced, then they go on to about 2.5 3 months.
Okay.
When we're talking about the axilla or bikini area, it's similar to the face, so it's 1.5 months. Once it reduces, maybe 2 months.
Okay.
So the reason why this variation is because our hair cycles of our hair growth on different parts of the body are different,
Correct.
and that's why the variation in the gap between sessions. So if you're going for a full body hair removal and you are doing the face and the arms, legs also,
Hmm.
then ideally your the frequency of your face sessions and of your body sessions need to be different.
Correct.
But because practically it doesn't many times is not possible for some people, so they do it at the same time. Ideally should be different. And then once you decide to go in for the procedure, we usually advise you that you should not be doing any waxing
Hmm.
before the procedure for at least 2 to 4 weeks,
Hmm.
because that's when your hair, that is what you expect the next waxing cycle to be. So you
Okay.
do not do it for at least 2 to 3 weeks minimum,
Hmm.
and then when you see your hair growth, that is when you come in for a session. Many clinics usually ask the patient to mark the areas at home and then shave and come.
Yeah.
And then there are some clinics, like we usually prefer the patient to come in, we see the what kind of hair growth
Growth.
is, what is the thickness of the hair,
Hmm.
what is the speed of growth, mark those areas and accordingly set the parameters. So there are
Correct. You
both
need to
ways
know.
how people do it. We
Hmm.
prefer doing it the way where you come here and then we shave it and then do the
Correct.
procedure, because it helps us see what the thickness of the hair
Correct.
is
It'll
and
be
the growth
much more accurate, the
more
parameters
accurate.
after
So
this.
that's how we do it. uh, Post the procedure, it's a pretty comfortable procedure. The maximum pain that you usually feel, how we usually explain it to patients, is like a rubber band snapping to your hair. So when you
Yeah.
pull a rubber band and leave it, and the kind of sensation that you get,
Yes.
that is the exact sensation that you get when you do a laser hair removal
Hmm.
procedure
Hmm.
around the areas that you need to do it in. Usually we use cooling, so the cooling may be integrated into the machine,
Hmm.
and that's what protects the epidermis from burns and also makes the procedure comfortable.
Hmm.
Post
It's
the
a
procedure,
good
yeah.
feeling. Yeah.
So you can either use cold air or you use
Hmm.
ice rollers to
Rollers.
cool the area post the
Hmm.
procedure. After that, for maybe a week post the procedure, we advise no sun exposure because the
Yes.
skin is sensitive. And of course, no sun exposure at least 10 to 15 days before the procedure, also. So,
Really?
if you remember, you had been somewhere and then.
Oh no. I don't know if I've
Yeah.
actually followed everything that you've told
So,
me.
that's one of the reasons why we always advise patients that if you're planning to do a laser hair removal session, do not get a suntan, do not go out in the sun, do not go on a
Yeah.
vacation, and then come in for a procedure, because
Correct.
your
It
doctor may not
targets.
always know what severity of sun exposure you have had. And then if your skin has become sensitive because of the sun exposure and then
Mhm.
you do a laser on it, you there's a very high risk of getting burns on your skin.
Yes.
So always avoid that. That's something we advise to all patients.
Also, keep your skin moisturized,
Yes,
is one
totally.
thing I learned.
These are a few basic things that we usually advise the patients, and then, of course, sometimes even after taking all the precautions, side effects may happen,
Yeah.
and then you have to manage them accordingly.
Yes, I had a few road
Yes,
bumps here and there, but I think now I know very well how to
yes,
manage a session also. I think putting a lot of moisturizer on
yes,
the
helps.
night before and even the morning of the treatment really helps me.
Correct.
Also, yeah, if the skin is sensitive, I don't come into the clinic. If it's
And because you
sunburnt
have
or
to use a
anything,
razor, that
yes,
also, it helps if your skin is moisturized and
yes,
it's not dry. Otherwise, the
it's going to
laser also
scrape it. Yeah,
leaves bad marks on it.
yeah. Hmm.
Great. I think we've had a good discussion on this,
Yes.
and this totally helps patients who are thinking of going in for a laser hair
Hmm.
removal. How has been your experience post completing the session? So
Oh,
we've almost completed all the sessions that
yes.
we wanted to, and how has your life in terms of your quality of life or
Hmm.
your daily experiences changed? What are the things that you notice really help?
Hmm. So some people who might not struggle with a lot of body hair will think this is over dramatic, but my life genuinely has gotten better because it was such a big concern for me.
Mm-hmm.
Um, and no, it's not superficial or it's not oh how you look or whatever. It's just how you feel
Yeah.
when it comes to body hair. And I mean, I respect people who don't want to do anything about it and are okay with body hair. But for me as a kid, it was a big concern. It did affect my self confidence, so it was important for me. Um, my quality of life has been so nice since the laser hair removal. Firstly, because I don't have to constantly worry about going to the salon or
Right.
calling someone home. That is one thing I do not like doing. I do not want to go to a salon and just sit there and get waxed. I have never liked it. It's messy. I do enjoy the skin treatments that I get done
Mm-hmm.
here because it's neat and clean and it's 20 minutes tops and I'm out of here. It's not a lot of lingering around, chilling. Um, so laser hair removal, firstly, I don't have to think about anything through the month. Secondly, it's not painful now. I did struggle a lot with the while getting the
Yeah.
laser done, but now the new laser doesn't even hurt, which is awesome. Um, Another thing is my a lot of other skin concerns weren't
It's not,
concerns
yeah, it's known as
anymore.
keratosis pilaris, when there's
Oh
ingrown
yes,
hair
yes,
and there's pigmentation at the
yes,
places where the hair grows.
little bit in the
Yeah.
red, like strawberry
Yes.
legs or whatever they
Strawberry
call
legs.
it,
Yeah. Yeah.
right? That's
Keratosis pilaris.
keratosis pilaris.
Yeah.
Okay, so that's what it is. I had that.
Yeah.
I didn't know I had that. Laser fixed it. Um, I
It is a
realized that.
textbook treatment for that.
Right?
Yeah.
I didn't even know that. That wasn't even a
Yeah.
concern, but it just fixed it, which was
Hmm.
these things are my most favorite things about the laser. Firstly, evened out my skin tone. Big time. Reduced underarm pigmentation.
Yes.
Beautiful. Um, Texture. My skin has never been softer. And
Hmm.
people tell me this. Like, if anybody is
The
just like,
quality
oh,
of the skin.
it's great.
Right.
It's so even, textured, colored, it's just even everything. So yeah, laser hair removal was the main point, but
Hmm.
it gave me all of these other things
Yes.
and it's made everything so much easier. I don't have to care for my body as much anymore.
Hmm.
I can just slap on some moisturizer and I'm good because a lot of people do use creams for KP
Yeah.
and for other things and evening out your elbows and your knees
And
and
those
all of
actually
that.
also dry out your skin quite a lot.
Oh,
The
do
creams
they?
that they use. Yeah.
Oh, yeah.
Because they're
So,
uh, remove the superficial hyperkeratinization that's there,
mm-hmm.
the thick skin that's formed,
Yeah.
and in the process of removing that skin, it also dries it out to an extent. So then
Yes.
you have to use more moisturizer for it.
Yeah.
Yeah.
Also, now I shave.
Mm-hmm.
So whatever little hair I get, which is honestly not that bad, I could just let it be. I
Yeah.
usually do let it be. But when I'm shooting or something and I have to get them off, shaving is so easy.
Easier.
Also, there's such thin hair that they immediately come off. They don't leave a stubble.
Right.
It's so much easier now. And it's convenient. I don't have to go anywhere. That is one thing. Also, shaving my back is a problem, right? You can't reach all areas of
Yes.
your back. So now that has gone.
Reduced.
It's almost gone. Now I don't need to do anything for it. That used to be a concern because if I waxed my back earlier, I would get
Right.
boils. My back was really sensitive and it could not take waxing. And calling someone over to shave your back is really not a good option. So I would just fully struggle. I'm like getting better at yoga to shave my back. Now I don't have to worry about that either. Yeah, these are the many ways in which hair laser hair removal has improved my life.
Thank you so much
Yeah.
for being so frank about your whole experience and sharing it out so that people who actually have those problems know what to expect from the procedure,
Yeah.
because that is really important that they listen to someone who has undergone that, the
Yes.
whole procedure, and share their experiences.
Correct.
And this is simply life changing, if I
It
like, from what
is.
I
It
gather from
is.
your experience, and I
Yeah.
of course know it from the other patients that we have. So
Yes.
thank you so much again.
Thank you for having me. Also, I do still come in for maintenance.
Of course,
I think
yeah,
once a
that's something that,
year.
yeah,
Yeah, or like once in a year and a half, maybe. And I'm okay with it.
yeah,
So keep that in mind. I think keep that in mind that you might have to do that, and
the
it's not a
maintenance
bad
side,
thing.
yes.
That's just how it is, and it's not disappointing. You've still come a long way. Yeah.
Thank you.
Thank you.